Good morning, good afternoon, and good evening, everyone, wherever in the world you may be joining us from today. My name is Francesco Del Carpio, and I am the Safely York Operations Coordinator. I would like to officially open the fifth session in our 2026 Emergency Management in Hospitals and Healthcare Speaker Series, presented in partnership with the Thunder Bay Regional Health Sciences Center. I would like to begin today with a land acknowledgement. First Nations peoples have lived on this part of Turtle Island for millennia, stewarding the land, the water, and all that contributes to life in this region. Today, the culture and presence of First Nations, Inuit, and Métis peoples enrich the lands and people of this territory. More than 2 centuries ago, the Mississauga people welcomed settlers to this territory, providing sustenance and engaging in trade and commerce. Between 1781 and 1820, 8 treaties were signed with the Mississaugas of the Credit First Nation, who opened their territory to settlement. Today, York University's Keele campus is located on Toronto Purchase Treaty Number 13 lands and is situated on the traditional territory of the Huron-Wendat and the Haudenosaunee. Treaty history is foundational, and it is our collective responsibility to honor the land, as we honor and respect those who have gone before us, those who are here, and those who have yet to come. We are grateful for the opportunity to be learning, working, and thriving on this land, and we commit to learn the truth and be active in the process of reconciliation. As this is an online event, our participants may be joining from various locations, so I strongly encourage you to learn about the traditional land upon which you are located. With this, I welcome our moderator, our speaker, and our participants from around the world. Welcome to our webinar. It's now my great pleasure to introduce Misha Richard. Misha Richard is the current Emergency Preparedness Lead for the Thunder Bay Regional Health Sciences Center in Thunder Bay, Ontario, Canada. For the sake of time, Misha's full bio, as well as our speaker's full bio, will be shared in the chat. Misha, thank you very much for moderating today's session and your ongoing help in putting together this series. The floor is yours.
Well, hello, everybody. Thank you for tuning in today. I have the delight of introducing one of our longtime attendees turned presenter for this series. So welcome to Frank. He's bringing a really diverse background to this conversation today that uniquely combines military discipline, medical pedagogy, and hands-on emergency response with over 2 decades of expertise in emergency management and critical facility planning. Currently he's doing academic lecturing as well as working in real estate facility management. So as Francesco said, we'll have the detailed bio in the chat. So really excited to have Frank with us as our first European speaker, giving an interesting example of some healthcare challenges in Germany that we might not experience here in North America, but certainly have some key takeaways as far as facility evacuation. So for folks that are new to the session, just before I hand the microphone over to Frank, I really want to thank you all for being here and encourage you to utilize the chat to communicate with each other. But if you have any questions that you would like directed specifically to our speaker, ensure that you're using the Q&A tool, and I'll do my best to monitor that. We have a lot to get through today, and Frank is very passionate about this subject. So without further ado, Frank, it's over to you.
Thank you. Well, good evening from Germany to wherever you might be attending this series, and thank you for having me today. Ladies and gentlemen, I don't know if can you see the screen? I still have Misha on the screen. Yep.
Just screen sharing, here we go.
Okay, ladies and gentlemen, with my presentation, I aim to highlight a European challenge with key takeaways basically for everyone else. I think so too. But while I will discuss this issue from Germany's perspective, we must not forget that our neighbors like Poland, the Netherlands, England, France, Denmark also have faced this war, which we are talking about, and they have similar consequences. Although I'm limiting myself to Germany today, there's others that have the main problem or the same problem too. I want just to acknowledge this shared burden. Could we have the first slide, please? And inspired by Francesco's speak, I want to just make clear that on us as Germans, the war is to be blamed. We have started it, and although we speak about the burden it brings for us today, we want to emphasize and to make the position clear that our responsibility is seen and is acknowledged. Next slide, please. We want to understand the relevance of the topic, and I think very relevant is that we have a lot of occurrences in Europe, in Germany especially. Next slide, please. One further, okay. And to understand what we're talking about, the unexploded explosive ordnance is a military term, is referring to explosive devices that did not function, did not do what they were intended to. So as they are military devices, they mostly have been fired by artillery or have been dropped by airplanes, have landed anywhere, and when they did not go off, they are just buried in our grounds. It just doesn't matter how old they are, because, well, in fact, it does matter, because the older they are, the more unstable they become. Let's just go next one, please. And yeah, why are we talking about it? Because these bombs and munitions have been dropped in an incredible amount over Germany, but also over all other countries that have been under Nazi occupation during this time, during this period. And lots of these did not just work like they were intended to, and they are still lying everywhere, beneath cities, farmlands, forests, in rivers. You find them in every place. And of course, they are deteriorating in their place. They are being rusting, they are maybe deformed by the impact, and the time is not on our side. Metal is rusting and corroding, detonator springs are becoming stable, and chemicals are degrading, which doesn't mean they are not working anymore. Okay, next one, please. And okay, one ahead. Thank you. I'm trying to make a comparison to our Canadian friends, so just to understand what we are talking about in terms of area and of population. I have found that North Rhine-Westphalia, which is one of our federal states in Germany, has an area approximately a bit more than Vancouver Island and a bit less than Nova Scotia. But if you have a look at population, you'll find that the population is in North Rhine-Westphalia, we are cramped. The place is basically completely full with people. You just seldomly find a spot where there's no habitation, city, village, something like this. Next one, please. And just to again compare the size, just one click more, it should be moving. This is Germany, taking out from the app True Sizes. It's an online app where you can compare maps with true sizes. So British Columbia and Germany, that's basically the match, but with a lot more of people crammed into this little slot. Thank you. Next one. Now, when we see North Rhine-Westphalia, which I have been referring to, we have about, this is the place where North Rhine-Westphalia can be found in the west of Germany. And if you see hundreds of 300,000 tons of unexploded ordnance still believed to be in the grounds. Of course, major cities are particularly affected because they have been bombed. And not one, but two or three, but a lot of retreating airplanes have dropped their loads on the way back when they have been shot at or something, anywhere. So it is in forests, anywhere else. And just to see the figures, in 2024, over 1,600 bombs have been discovered and neutralized. And the increase, as we might find later on, comes from a increase in construction, because Europe's infrastructure is aging, and we need to renew roads, railroad tracks, buildings, even hospitals. And this leads to a lot of discoveries, which, if you realize, many houses are built on ground which has bombs underneath them. So it's a miracle that we don't have more of these incidents. Okay, next one, please. Mhm. This is just to give a slight oversight. It's just to have an idea what we're talking about. Because I took this 2024 example. It was a phosphorus bomb at Frankfurt Airport. It's one of the main airports in Europe. And of course, it has an immense impact on infrastructure. Of course, you cancel flights. You don't have to imagine a lot of this because if you have a bomb on the airport, you just can't let any airplane come in. So temporary closures in in road traffic, main traffic on the roads. There's an autobahn going down on the airport. Are the consequences. And of course, this is not a complete list of findings. It's just a few ones I just wanted to single out. The one in 2025, Cologne, in August 7th, is a partially detonated bomb. Partially detonated means there are still detonators inside. There is still, explosive inside, and it's not safe to be handled. We are having bombs, we have diffusions, and we have controlled detonations. I will go over this in a few slides. Okay, next one, please. Next slide.
It's just an opportunity for you to have a sip of coffee, Frank. For everybody's awareness, we are sharing slides for Frank
Yep.
Because of some kind of security. Oh, one moment, everybody.
Sorry, my Zoom crashed. I'll share it right again.
Oh,
That's okay. Thank you.
There we go.
okay, go one further, please.
Francesco, I think it just doesn't like you today. Are you able to advance?
If not, maybe Misha can just pop in. I don't know.
Oh, there we go.
Okay, very good. So when Misha asked me to speak about this topic, there were still
One
developing
more?
information.
Okay.
Yeah, so Francesco?
Oh,
Where
we're
was
good.
the right? It's okay. Thumbs up. So when we agreed that I would just speak about this topic, we had still developing situations. So there have been so many discoveries since our talk, and the last one was last week, basically May 28th. It was an artillery shell, which is also a big one, and it had to be detonated because it just couldn't be handled safely anymore. This was a small evacuation. It was just 1,200 people, and it did not involve any hospitals. So some of these don't even make the news anymore. Okay, next one, please.
Oh, okay. I'll start sharing my screen instead. I had a sneaky suspicion. Apologies, everybody on the line. Give me one moment and I'll get this up instead. Okay. Okay, and advance.
Thank you, Misha. Small lesson in emergency management. We have shared the screen, the slides between 3 people to get them running. Yes, I just already said that we are seeing a lot of construction. And in fact, in Germany, it is a lawful thing to, when you start constructing anywhere, you ask a certain service. It's a government service, and they have aerial surveillance photos from World War II, historic photos. They have new satellite imagery and also aerial photos. And so they start researching on your lot where you want to construct if there is a possible site of unexploded ordnance. and they are right in, I think, about over 90%. When they say there is something, they will find something too. Although there are surprises too. Next one, please. One again. Oh. This is the title was "What do they do?" What do these devices do? They basically cause major disruptions to daily operations. They cause a lot of stir in the society because people, of course, have to leave their homes. Maybe you have to evacuate a hospital. You have to stop trains coming into a train station. You might have to stop the autobahn, the highway from running. And of course, they are also a source of fear for the local population because not all of these operations go according to plan. And there have been losses of life. There have been losses of infrastructure because of a detonation of such a device. And you never know in advance. So here you just have an idea. It was a 1.8 ton unexploded bomb in Pforzheim. And the city has set up a 1.5 kilometer radius for the bomb disposal team, and firefighters, police, and bomb disposal experts prepared to defuse the bomb. And all these people you see in the picture are, of course, people that you need to attend to the population that is going to be evacuated, and which are lacking if you need to evacuate a hospital or an whatever place. Huh? Okay, and here in this place, we evacuated 27,000 to 30,000 people. And when you look at the date, May 15th, it was discovered, and May 17th was the diffusing, and it was fortunately successfully diffused. That makes a little difference to our everyday operation as emergency management planners, because you have more time to plan and to get people where they should be. Next one, please. That's the big boy. The explosive ordnance people, they have my deepest respect for approaching such a junk and starting handling it. So they always have to stop after the process to allow for press photos. That's one of them. So you at least have an idea what was buried there. And you see from the status, it was not very good. What do they look like? They can be appearing like a bomb, like you expect a bomb to look like. If you see the picture on the right corner, this one was found, and you read it right, in a kindergarten. It was found by the kids. It's an incendiary bomb, an incendiary stick. After the big aerial bombs, they have been thrown. The big aerial bombs should have removed tiles and the roofs of the buildings, and then the incendiary bombs would have been falling inside and starting fires. So it looks like a piece of junk, and it's basically an incendiary stick, like a phosphorus grenade. The other ones might be more telltale and might be giving away what they are if you see them, but mostly they are covered in mud. They might be rusted. They might look like whatever piece of old metal. The one in the bucket down there in the left picture is a phosphorus incendiary bomb. If that one goes off, you just can't put it out. Next one, please. This picture is one of the EOD guys showing one of the detonators. These bombs, they have up to 3 detonators, and depending on the type of detonator and if the detonator can be reached by the circumstance where you find this bomb, they might be trying to defuse it, or they just say, okay, we have to explode it, we have to detonate it because it's not safe to handle it. Okay, next one, please. That's what it looks like. The cloud you're seeing there, most of it is water, because the bomb has been controlled, detonated in a controlled environment. And the EOD is placing stuff like sea containers filled with water around it to minimize the shells going anywhere, shrapnels and stuff. The problem is you can basically diminish the outcome of the detonation, but of course energy must go somewhere. If it can't go up, then it will shake the floor, the ground, and it might do damage to bridges, houses, and stuff. Everything is shaking like in the earthquake. So that's what it looks like, and you see from the size that it's basically not fun. What you see else as an emergency measure, well, basically, I think your first looks are for the power lines, the tracks of the railroad, and maybe even the powerhouses. And underground there are there's gas pipes, sewage, fresh water, energy, like power lines, and everything down there that might be damaged. So when we're coming to a hospital, it doesn't mean when you're out of this situation that you can safely return and start your business. Just switch on again and start again. It's you have to hope that everything went fine. Next one, please. This happens too. In this case, it was a construction site. Nobody had a chance to know that there was a bomb underneath, and the excavator operator has been killed during the explosion, which caused a mass casualty event. It's just the aftermath, what you're seeing on this picture. Next one, yeah. In reference to the first picture of the excavator detonation, if something happens like this, when you have a construction site near your hospital, you're just on the edge. Okay, there can be found anything from a Roman encampment, which is a catastrophe too, because then the archaeologists start closing down your construction site. I love archaeologists, or they just find a bomb. So something in Europe, something is very liable to happen. So the differences. If the EOD identifies the unexploded ordnance and says it is critical and unstable, we need a rapid evacuation because they will be exploding it, or they just don't know if it might go off any second now. It happens, but most cases that are recorded and that are being observed are stable UXOs. That means the EOD looks at them, makes an excavation, says, okay, we can see everything, we can get to it, so it is considered stable, and so we start planning our diffusing mostly for Sundays. They go for Sundays if they can plan it. And that means your plan will start. You must always be ready for the red box that someone calls you and says, okay, forget everything, the thing has started fuming or something like that, and we need to get everyone out at this moment. So the comfortable stage of stable UXO can change at any second now. Next one, please. I have copied you. On the right is the original text from the state of Baden-Württemberg. And these are the planning requirements and protection objectives of the state to say if you find something, what are the protection objectives. And of course, the protection of life of individuals and of working staff in the hospital and of the patients is the highest priority. So in doubt, you just get everyone out and you plan later. And the additional protection of objectives are maintaining level of care for people that are in care. So they should not have a worse situation by being evacuated than they had in their basic hospital where they are. And consistent with normal operations, I think it speaks for itself. It should be in Germany, where we have a really dense net of hospitals. We should be able to provide care for everyone on the highest level. A little bit later on, you'll see a map and you'll see what I mean. The critical infrastructure is something that's coming up lately, I think since 4 or 5 years. since we had a lot of incidents like people stabbing a lot of people on marketplaces or cars running into places. And of course, the war in Ukraine, where we started seeing drones getting into Germany and into Europe. So we have identified some places that are critical infrastructure that need special protection. And of course, a hospital is part of critical infrastructure. Although we have to say the functional capability of critical infrastructure is something that's very, very fragile. In Germany, every hospital is above earth. You just don't find them in bunkers underneath. In Ukraine, you won't find a hospital working above earth, I think, for obvious reasons. The prevention of reputational damage is something the state wants to enforce, that the public should be able to have a big trust into the functioning of the organs, so as be the EOD, police forces, the firefighters, and of course the hospitals. Okay, and the business continuity, something that we must address too. How do we keep our client or our hospital running later on? What do we do to minimize any disruption in business? Okay, next one, please. Yeah, an evacuation which is not the rapid evacuation is something where you start thinking a lot and sweating a lot. I don't mind telling you, because then you have to plan thoroughly, and you are blamed for everything that's not going smooth. And the structured manner is something that's expected by everyone. You just can hope that there is a plan. Someone made a plan. In preparation to our installment, I have surprised myself by asking some colleagues, and I was surprised some didn't have a plan for this occasion. It was only two, but well, they started planning. So they have been surprised by this question. So it's not really given that you have an emergency plan for this situation. Determining the number of patients that are at this moment in your hospital is a nightmare in every given day. So there's patients, there's people coming into the emergency ward, there's people coming to visit patients, there's, well, craftsmen, everyone can be in the hospital, and you have to find out how many people are there, stop normal operations, and start getting people out. Yeah, so start getting people out means no more access to normal operations, and the only influx is maybe people coming in to take patients away. That's the early discharge of patients, which is something that we do. If someone has a condition that you might be responsibly discharging him, so early discharge. Elective procedures have to be cancelled. And then is something down there, suspension of routine hospital operations. Not everything is related to the patient at this day. There are things like repairs going on or construction in the hospital. Whatever it is, you have to get ahead of the situation to also to tell also these people, you have to stop your operations and you have to minimize damage, if possible, to the next step, which was evacuation and then coming back later on. So these might be any operations. In one hospital, I had an installment where people came in the afternoon to hear a speaker, but well, we had an evacuation running. So you don't need people coming up to the parking lot that want to hear a speaker and are confused about why is there such a fuss with emergency service and fire brigade. Yeah. So if you can get to these people and stop them from coming to the site, it would be very valuable. Next one, please, Michelle. Yeah, and the co-working between the emergency dispatch center and the hospital is crucial because the hospital itself can't possibly get every patient to every place because it's just too much. So the Emergency Special Center uses a special software. This is called Evina. I'll have a screenshot later on to explain it. And this software is a live overview where in Germany is what hospital in Germany has what patient numbers and what capacities to take on patients and what specialty like surgery or pediatrics, psychiatry or internal medicine. And the softwares Orbis or Medico are our internal internal hospital softwares where you can manage patients and can basically transfer the data to the next hospital, which would be the taking hospital. And of course, you have to talk to your colleagues in the other hospitals because they will have a massive influx of patients suddenly, which are under treatment. It's completely different if you have, and most of you might know this, if you have a patient that has been on the intensive care unit since a week, he has a medication plan, he is running on medications, and you just can't just put him on the ambulance and start anew with another doctor that has to find out what happened and get a new medication plan. It might even affect the patient itself. Yeah? So, patient documentation. We are, at the moment, we are trying to do everything digital. It could be a big help, but at the moment it is in a stage where it is not really reliable. So the old way to have a folder with everything printed out might have been a good idea at this time. Today, you can only hope that everything is digitalized and the receiving hospital has the ability to just work with the data. Yeah, special considerations. There are a lot. Just one example, psychiatric patients in Germany, when they are under psychiatric attention, it's okay. But if they have to be moved, you require police escort because you just can't put them on the ambulance. And the ambulance staff is not allowed to restrain them or to keep them, basically to detain them. So it has to be the police. This might be when a psychiatric ward with adult patients or a psychiatric ward for pediatric patients is affected. It might be a very, very special requirement and a big challenge. Yeah, the planning and requesting of transport capacity, this includes buses, taxis, the Uber driver, it may be, but it has to be planned and you have to get the people out, in and out. So you have to plan your routes to get the hospital flowing. Yeah? And something that is really bad if it goes amiss, the early identification of stuff. It's crucial. The public too, because if people have a child in the hospital and they learn from the media the hospital is going to be evacuated, you might just imagine for yourself the nightmare that just is used for the patients and for the parents. So early identification of staff that they know what's going to happen, also for the staff that is off shift, and the public, of course, media representatives and patients and their families. Yeah. Next slide. This is a screenshot. I just wanted to show you. This is Evina, and it is Evina in Hessen. This is the state where I live, and it shows you the on yellow the emergency dispatch centers for various counties and the attached hospitals. So you already see there are some dispatch centers. They have a lot of hospitals to manage, and then you can just go to the special hospital and you can look if they have surgery or have capacities for pregnant women or for people from psychiatric wards or surgery, trauma, whatever. So this is Evina, and it's an online live view. The other live view is this one, where we have an app. I have the English description down there. You can see where in Germany there are hospitals and what bed capacities they basically have. You just can't see if they are occupied or if they are able to receive patients. But it's a big help if you just need to have a graphic map to see where are we going to shift people to and in what ranges. On the other hand, you see how many hospitals there are in an area where in Canada, basically, there would be two, maybe, if you're lucky. On the last installment, they were talking about burns, about hospitals with a specialty for burns. It was, I think, 4 or 5 about Canada, in a big area. So where you need air transport. Here, basically, you can just work with road transport. Okay, next one, please. Yeah, the parties involved in the planning process, I mean, before you start something like this, should be the hospital's fire safety officer. For Canadians, it might not be quite understandable. In Germany, we don't have an emergency manager per se. We have the fire safety officer, and if you are lucky, you have some people that have the ability to do emergency management. So the cooperation between these two is essential. Local authorities and partner organizations like other hospitals or the cities, and it depends on where the hospital is, it might be the county or the city that is responsible. Emergency medical services, there are basically a lot around Germany. It's a Red Cross and how they are called. And all of them have different capabilities. And some of them surprise you if you just ask them, if you had an evacuation order, what would you offer us? And just let the experts do their job and be surprised what they just suddenly do magic and get ahead. If the time is right, the day is right, and it's not holidays. Yeah, fire department, of course, police and the psychosocial crisis management services should not be forgotten because you need them after such an event. Okay. A uniquely German thing. Misha told me I should not brag about it. I'm just mentioning
Brag
it.
a little bit. Brag a little bit.
It's the Technisches Hilfswerk. It's the Federal Agency for Technical Relief. It's a organization that we have in Germany that's consistent of more than 88,000 volunteers, a lot of equipment. And if you need someone more than the fire services or more than police, that's the people you call. And if they don't manage it, it's the army. So wherever you are, it might have something similar. Just don't forget about them. Next one. Okay, I have designed a completely fantasy hospital. You might just have a look at it. And this hospital is suffering from a lack of place for the administration because administration is growing larger and they need a bit more for their data center. So they need, because they are implying artificial intelligence, they need a bit more energy and a bit more storage and room. So they want to construct on a construction site near the other buildings. And oopsie, of course, next, yeah, they find this. That means you are now starting to think about evacuation or not. I'm just having, I have just given you the 200 meters, and normal evacuation would be about 1,500 meters. The immediate priorities for you are to think about what are the potentially affected areas. And in my example, it's the portable water main line, it's the grid power, it's the administration itself that in case of an explosion might be damaged. Of course, it's the ICU, internal medicine, and maybe even the emergency department, everything. So your priorities in evacuation go from the bomb site afar. Yep, and this is just to have an idea. Okay, there might be some more clicks, and 2 and 3, and then stop. Okay, and things like the IT fiber optic cable, which we have a lot of them today. an old cable with iron or copper, if it was a bit damaged, you still had traffic on it. A fiber optic cable, if it's damaged, it's just off, so it's offline. This just gives you an idea about how fast you're thinking about evacuation of a whole area. In Germany, hospitals are very, very densely built. These 200 meters are already realistic for a hospital building in Germany. No? Okay, next one, please. So the key challenges, apart from thinking about what areas are affected and what services you might have to shut down, is by the way, I forgot something. Just could you go back to the first slide, to the slide? Yeah. I have written what services are being shut down. Some hospitals, they offer telemetric services for patients at home or whatever. They might be shut down or might have to be transferred to another entity that takes on these patients to care for them. Because if you have seen, there are 3 to 4 days of evacuation going on. This might mean 3 to 4 days of a service that is crucial for some people being shut down. Yeah? Maternity wards and stuff. Pregnant women, they just can't plan their stage in hospital. They have to be rerouted to another hospital early on. Okay. I see that this picture is maybe a bit smaller than I intended to, but I hope you can see it. You have to access the patients, which are ambulatory or non-ambulatory transport needs. How do you get them out? Just a repetition. And you have to cancel post for non-critical treatments. Some logistical things, what season is it, cold or hot? Can you just park people outside to wait for the ambulance or buses to get them away? Is it holidays? Have you all your stuff everywhere? And stuff is just something I'm not really happy about, because all hospitals and emergency service and the police in Germany have a problem staffing their numbers. So we have vacancies everywhere. So it might be difficult to get enough people together. Although I must say in Germany, a lot of this is being done by voluntary services, which I'm very happy we have them. So how many staff members do you have? And then one of the important tips, clear and unmistakable markings everywhere where you have gotten people out. The evacuated areas have to be marked so everyone knows from the outside and from the inside this room or this floor has been emptied. Okay. Repetition, no? Coordinate with fire emergency services, public transportation, taxis and buses as available. And the patient documentation, ensure complete records for transfers, because many of stuff is during the day-to-day business is being handled. Get it together and get it with the right patient. And this is something I have also learned: right patient, right baggage, right destination. This is not something that happens very easily if you plan for an evacuation of many people. And you have not to forget, if you have to evacuate this hospital, normally around the hospital are homes, and they have to be evacuated too. The hospital gets the priority, and they are starting early, but it might be difficult to get everyone to the right place. Okay, next one. I see for the time I have to hop on. The patient safety
is. You told me to warn you, and I was about to give you about a 10-minute there, Frank.
Yes, I'm getting on. The patient safety is paramount. So in aspect of not being on an exploding bomb, as well as not being hurt or being deteriorating during transport. The operation continuity means also that some people have to get backups of their system, because if you just leave I'm just exaggerating, I know. If you just leave your workplace and you leave your stuff, do you have a backup if when you come back there is nothing else, nothing more, because it has burned, has been hit by shrapnels, or the power lines off? Yeah? So do you have backups of all systems that have to be restarted later on? And one of a good emergency manager said, Mr. Korczynski, a clearance is simpler, you just act. Evacuation requires a lot of planning. Next one. I'll leave this just to understand what I mean. A clearance, as we call it, the rapid evacuation, acute hazard like fire or something is limited, specific zones. You hope that your fire services are quick. You hope that your building has its compartments and it works. But a bomb clearing means you have to involve the entire building. It's highly complex, and you have to get people off the site and relocate them to other hospitals. Whereas in a fire drill, you just move them to the next level. Okay? This is something I don't know about your businesses, but staff training. When they see the emergency manager, they go like, "Oh, he's again going about stuff." And of course, but you have to tell them, and you have to make it their mindset. Crisis can happen everywhere. The drills have to happen, and in Germany, it's a problem because we don't have money for the drills. We don't get funding for this. This is one of the challenges. Yeah, and things like stairwells, transportation routes and stuff, they are not really evaluated during such a situation mostly. So you learn a lot about your building in the moment you start getting people out. Because the building is, when I started as an emergency manager in a hospital, I just found it running, it was operating. And suddenly if you start a drill or something, you learn more about the building than you wanted to know before. And financial support is something, it's a problem in Germany. It's starting slowly. And of course, the initiative of the idealists, of the people who start getting an interest in emergency management is not always seen as productive during the daily business. Okay, next one, please. The self-protection, yeah, I think it's self-explaining. You should think about your staff safety, about patient safety, personal equipment, protective equipment should be worn. This can be most important to get your people out. So a clear chain of command, and this clear chain of command, to maintain it during movement, when you start moving, is, I think, one of the most difficult situations to get people, so that everyone is searching you and asking you, but you have your chain of command, you have your people, your aides running through the building, so everyone knows where his place is and starts getting people there where they should be. And yeah, it's not necessary to find you, the one who is then the small spot. And one advantage is, you know, you're in trouble, so you don't have to realize it first. In other emergencies, sometimes it takes time to realize what's happening. Case study, please. Frankfurt, just to show you a idea how dense the populated area is. Next one, please. And they had to evacuate 3 hospitals in this area, plus the residents of this area. The small pin, basically in the middle of the screen, is where the bomb has been found, and it was a big one. Okay, next one. And this is just a small timeline to understand what we're talking about. Yeah, on Tuesday, August the 29th, it was discovered. And then people had taken some time to evacuate. And look, on Friday, they started activating hospital emergency plans and started evacuation of 3 hospitals. Fortunately, in an area that is saturated with other hospitals. In Canada, or in Africa, or any place that has not such a dense net of hospitals, I think the transportation times would be a nightmare. Yeah, and fortunately, the defusing was completed without further incidents. I won't go too much into detail. The picture on the left shows you a little blue tent, And this little blue tent is just erected over the bomb. It is absolutely crucial to protect the device. And in these times, like we are seeing a lot of courageous people flying drones everywhere, it is important to protect a bomb from a falling drone or something like this. But back to the hospital, the crisis management team had to coordinate evacuation and had to see to discharges, to see to critical patients that could be transferred only with big care teams like intensive care units, where to and how, and they managed it. And fortunately, they had a children's ward, a children's hospital very near, where they could put the pediatric patients and where they could just safely redirect the parents. So it was not a big detour for them. And as I always said, pregnant women had to go to another hospital. And this is just to understand the density of the area again. We have seen it in the air picture. It was a 1,000 meter radius where everyone has to get out. By the way, an empty hospital is an attractive place for people who have nothing else in mind than to roam through it and to collect stuff. So that's why police has to protect these places, even under evacuation. Yeah, there's the picture of the innocent-looking blue tent which covered the big bomb. Yeah. Okay, thank you. Next one. And as a counterexample, we have a fire in a hospital, emergency manager screaming at people, then people getting patients out, fire drills, fire service extinguishing fire, fire is contained, and I just don't have the slide of emergency manager apologizing to people he screamed at and giving a lot of coffee away. So this is about an hour, and the fire was contained very easily, very quickly. We didn't even have a lot of smoke, so we didn't have to give a lot of time to get in, and it was about an hour, and things were safe again. So that's the difference. Okay, I think we have most of it. There's one thing I didn't write on this, but I would like to emphasize. If you are in a situation in Europe or anywhere, or maybe even in your home country, and you have construction sites popping up. In Germany, you have a newspaper where they have to publish when construction is being started. And if you see there's a construction site starting, just go over it. What if this construction site would become a problem? So just make a small tabletop exercise for yourself, for your stuff, and just think about it and put it in your drawer. Maybe the drawer is being opened a few days later, very in a hurry. Advocate for emergency preparedness funding, we do it, but yeah. And staff retention, well, refreshing training is something, it costs money because a nurse, doctor that's not on his place is costing the hospital money, and I know, but these are the people that are going to do what we're planning, and we need to train them. Okay, Misha, next one. Okay, this one goes out to you on the monitors, and my deepest respect for the work you do. I know that what I was talking about is maybe a little something very curious, but I hope it was helpful. Okay, and I think I even got 5 minutes.
Yeah, so then some helpful resources.
Yeah.
So now they've been on the screen. I must stop sharing in order to do my position as moderating. So I really appreciate you bringing this very unique experience to our audience. I'm sure for many folks, they're thinking, well, we don't have the risk of unexploded ordnance exactly where we are. However, the discussions around how you try to either plan a full hospital evacuation, um, or have to rapidly do it, whether you plan for one or not, is something that we can all learn from, regardless of what the trigger, no pun intended, is that's requiring us to evacuate the facility. Just as I'm talking to folks here, if you have any questions for Frank, we have a couple of minutes. You can throw those in the Q&A. I was going to note, so Frank, you brought up an interesting point. You folks are very integrated technology-wise from a country level, which is something that I'm a little bit disappointed about, that we don't have access to some of those same resources that you do. But you had noted the patient sort of evacuation tracking and commented about you'd like to be able to do all of those things electronically, but that means the default is there has to be some sort of hard copy that's going with these patients as they're evacuating. And I don't know if you want to share any of that kind of any of the little granular points of how you've witnessed some of these evacuations take place. I know you had to kind of give us a really high level overview and give us the background context, but let us know some of those little details if you could.
It is a complex situation. I'm only speaking for Germany and only speaking for my small view where I have some experience. And we are in a transition. And as I said before, when we had the slide about the stable UXO and the unstable UXO, yeah, I think one of the most difficult situations is when you started moving people and then situation changes. And then you have to go on running. So this is something difficult. And in a similar situation, we are on the topic that you addressed, because Germany is not a really digital place yet. We envy many places like Eastern Europe, where they have an excellent internet and cover of internet and digitalization. So we are still in this transitional phase, and this is something where a lot of data is dropped. Yeah? It's just falling between the chairs, as we say. So for an emergency situation, I think it's still necessary to learn more and to get a more stable infrastructure to employ it everywhere. I have showed you there are software solutions for some things, but they're not the same in all hospitals or in every state. So we have a federal system. Yeah, and one state might have a law making it this way, and the other one has it, well, on the other way. So on the practical level, I think it's working quite well. And this is something where I'm a bit, as we say, where I distrust the system because it runs on the little people. The system just works because people like us and people like the doctors and the nurses, they just work with each other, but not because the systems are so very compatible, because everyone just tries his best to make his colleagues working with the patient. So it's not a thing that is due to the system already.
I know we're basically at time. I think maybe we'll just take an extra minute or two. I was just going to thank you for also highlighting the point that these evacuations are not done in a silo. For our audiences from North America, I would say wildfire risk is one of those considerations that we might have for a full facility evacuation. And certainly in that scenario, it's impacting the entire community. So, as you said, the prioritization really has been put on hospitals, patients, and healthcare workers. But I think it's worth those attending to have some of those discussions as far as MOUs so that there aren't conflicting claims on resources like ambulance transportation, like medical transportation, or city bus use. Sometimes I think we might take it for granted that those resources will automatically be made available to us. A last question specifically for you, Frank. I saw somebody put it in the chat, mostly as a curiosity, as far as are authorities tracking the changes in the estimated amount of unexploded ordnance in the vicinity of hospitals. I don't know if you're aware. It sounded like there's a lot,
Mhm.
but maybe not definitive numbers for this.
Yeah,
What's your
the
projection?
monitoring, yes. There is a municipal, but also a federal monitoring. And the services I mentioned in the beginning, they are using, as I said, they are using satellite imagery and stuff to try to estimate how many there are still, and they are trying to track the progress. But it's something like in another installment, there was an excellent guy talking about demining. And you just don't know because you didn't put the mines there. You just went through a field and you are sure you got maybe 10 or 12, but you don't know if there were 90 because you just don't know it. Yeah? Um, Earth moves, things are surprising that happen. So, yeah, but the authorities are tracking and are trying to get a overview, but it will be years. And I think if I could make a wish, it would be that people learned from this. War is something that affects generations.
I guess maybe we'll leave it there. Um, as Frank pointed out, we talked about this topic, and since we first discussed, there's been so many instances in the news. This is a very real threat that is actively responded to. So I want to thank you, Frank, for bringing this to everybody's attention on our series. I
Thank
know
you.
there were a couple of questions that folks had, and I think we'll request that those be directed to Francesco, and we can try and get some answers to those folks. Our poor coordinator, Francesco, for everybody that knows him, he's really been having some IT issues, which I feel is quite suitable for an emergency management series, that something must go awry once in a while. So I'll thank Frank for his patience as we kind of worked our way through that. I want to thank you all for attending, recognizing that this session is recorded, and hopefully we'll have that up and available for you soon to share with your own networks. And as a last reminder to folks before I sign us off, we don't have a July session. It would have fallen on Canada Day, so we will be taking that as a holiday and we'll regroup a little bit later on. So stand by for that. Again, thank you all for attending, and thank you so much, Frank, for being our guest speaker today.
Thank you for having me, and I hope you have a fine and good Canada days. Be safe, everyone out there.